just a few housekeeping notes that I will go over before we start the webinar, and as people continue to log on, we'll just go over a few things. The webinar will be recorded, so you can access it later either on our YouTube channel, or we will also have it on through GoToMeeting, the application that you're using now, and we will have links for those posted on our website and in emails and on Facebook. You'll be able to get to them any of those ways. Everyone is in listen-only mode, so that means you don't have to worry about any of the background noise at home. If you have any questions throughout the webinar, there is a section down in the bottom right-hand corner where you can type in your questions, and then we'll be gathering those questions throughout the webinar, and then towards the end, then we'll just go through them with Dr. Wright and Michelle, and we will typically get through as many as we can. We try to stay as close to an hour as we can. And then if there's any leftover questions, we can have those posted on our website too. And I think that's about it. I think we're just about ready to go. So without further ado, here is Dr. Eric Wright and Michelle Harvey.
Good evening, everybody. Thank you for joining us. Michelle, would you like to say hello to?
Oh, hi. Hello, everybody. Dr. Wright is actually going to be starting us off, and I will be chiming in throughout the presentation.
Very good. We're so happy that you have joined in, and so tonight's topic is really one that's important, particularly. I'm going to give you a little background of myself, and I think Michelle might be able to do a little bit of this as well. So I'm a parent of 3 children, and they're all elementary school age. I have my oldest daughter is 11, and she is an adopted child, so she has moderate to severe disabilities. Her name is Ella, and she is in a partially included setting where she receives about 40% of her instruction in a regular ed setting and 60% of her time in a special ed setting. She's a 5th grader and 11 years old, and then my daughter that has Angelman syndrome is Elsie, and Elsie is an 8-year-old who is in a fully included 2nd grade setting with complete support. So when I say complete support, she has a full-time aide that is with her the entire day. And then my youngest son, Ethan, he's a 5-year-old kindergartner who's just doing fantastic. I guess we would say he's neurotypical, and therefore he's developing typically. So I'm going to let Michelle kind of put her introduction a little bit to her involvement with Angelman syndrome and special ed as well.
Yes, I am actually not a parent. I am a sibling. I have 2 younger brothers, one of which is now 19 and has Angelman syndrome. I am currently teaching special education in the Nashville, Tennessee area, and love the combination of knowing what it's like on the family's side, as well as being an educator and writing these IEPs and carrying out this specialized instruction. So I hope we can give you all some helpful tips tonight with writing IEPs and connecting that specifically to Angelman syndrome, hopefully.
Thank you. All right, so let's get started with our webinar tonight with the first slide here, and hopefully we'll have no problems with this. And sometimes you have to see how things move along. Currently, bear with me. There we go. So, essential questions. So hopefully we're going to talk about this evening are going to be, we're going to be able to answer these questions, specifically what is the law that was passed for students with disabilities and how is it reauthorized? When were our state rules released with the reauthorization? What sections are in the special education law? What resources are currently available for you on IEP compliance, and where can you get help and access fees. What is the purpose of special education? How is special education defined in the law, and what does it really mean? Describe the purpose and the importance of IEPs, and list the components of an IEP. Describe the three main areas, and this is an area that I think will be talked about quite a bit of an IEP that should connect and flow together. How do you develop an appropriate present levels perspective? How do you develop appropriate goals? What's the appropriate services that you need in your IEP? And how do you know whether to check yes or no on special factors questions? And what comments do you include? Why are regular education teachers important in the development of an IEP? And describe all the different services and supports on an IEP. And how should an appropriate IEP develop? So let's first talk about the purpose of special education. What are the special education rules designed, and I'm sorry, I cannot see this slide over here. I'm going to slide this down and hopefully be designed to do. And with that, students with disabilities should always receive what's called FAPE through the following. FAPE is appropriate education, free and appropriate education services. And special education and related services have a dual purpose. It's designed to meet very unique needs of a student. And it's actually to prepare, when you see the word or the acronym SWD, that is for student with disabilities, for further education, employment, and independent living. And oftentimes, these three they're bound together, because the more likely they get a quality education, the more likely they're going to find employment. The more likely they find employment, the more likely they're going to have independent living. So when you do an individual education program, it's really the program is to accomplish, I think, these three main tenets of special education or related services. It's to provide for education, employment, and independent living. Okay. Going slow here, apologize. Did you want to add anything in on that, Michelle?
No, I think you hit it all. We're gonna touch on the specially designed instruction. Okay, there we go.
Yeah. So, what are special education services? First, it's specially designed instruction, and what that is instruction that can take place first let's talk about where the instruction can take place. It can take place in a classroom, a home, hospital, in institutions, and in other settings. It could be in a physical education, speech, travel training, and vocational training. Now, Michelle obviously does a lot with specially designed instruction. And what specially designed instruction, or SDI you may hear it as, is individualization of instruction. And it's specialized and it's very specific to the student who has the IEP. And so with that, I say adapting or modifying or adapting the content, the method of delivery for the delivery of the instruction. It's really about those three major components: content, methodology, and delivery instruction. This is an area, I tell you, that I see as a lot of struggle with typically regular ed classrooms, and even special ed teachers, because math methodology is very distinct, and sometimes the delivery of that instruction requires some very specially designed adaptations and accommodations. So why is it important? It's really to address the unique needs of our students so they can have access to the general education curriculum. Bottom line, the more we get students to have access to the general core content curriculum, the research shows the more likely they're going to be successful. So what is an IEP? An IEP, it's what the acronym stands for, is Individualized Educational Program. Therefore, IEP. The IEP is a written legal document that describes the education plan for a student with a disability. So children with Angelman syndrome qualify for an IEP. Among other things, your IEP talks about the specific disability. There are 13 major areas of disability, and Angelman syndrome does qualify under the disability typically of moderate to severe or functionally mentally disabled. Sometimes mild mental, but typically, and you can maybe even with some health issues under other health impairment. And then if you have another health impairment, such as a seizure disorder and the moderate to severe disability, you may qualify for multiple disabilities as well. In fact, my daughter has a multiple disabilities diagnosis because of the seizures. The IEP talks about what skills you need to learn, what you'll do this school year to learn those skills, what services your school will provide for your child, and where your learning will likely take place. I like to talk about where your learning will take place because I'll get into this a little bit. The least restrictive environment is what I tend to try to follow. So you think of it like this. The least restrictive environment means you have greater access to the general education classroom, or you're more in the mainstream. And the more likely you're in the mainstream, I think you're less in a, you're obviously going to be less in a restrictive environment. The more restrictive the environment means, the more likely you're going to have what's called a self-contained unit where it's only students with disabilities. So I tend to try to see you trying to access to the general ed curriculum in a mainstream environment with a sprinkling in of what I would call our part-time environment in a special ed setting. So what is the importance of an IEP? Well, the importance is it's a written statement for a child with a disability that is distinctly individualized. And it's developed and it's reviewed and revised in accordance with IDEA 2004. IDEA stands for Individuals with Disability Education Act. It was reauthorized in 2004. And the individual education program serves as a framework for determining what is meant by the term free, appropriate public education, or FAPE. In the least restrictive environment, these are all acronyms that I think it's important for parents and individuals who are going to be serving children with Angelman's or adults with Angelman's in the least restrictive environment, which is the LRE that is so frequently referred to in IDEA. IEPs must be developed and reviewed annually and must be in effect at the beginning of each school year. Compliance is a big part of it. Parents have to attend these meetings to make sure students are receiving the IEP appropriately. And then also the school district has they have to follow the law. And the law says that they have to have these goals written annually to make sure that they're addressing the students' needs. All right, so let's get back here, hopefully. All right, so why do students with disability need an IEP? Well, as I just mentioned a few seconds ago, at first it's the law. And the Individuals with Disability Education Act requires that each student with a disability or who has disabilities receive special education services to have an IEP, which is the education program written just for him or her. It really is individualized for that student. And second, the IEP helps the school meet the special needs. I also put this in here. It also helps you to plan educational goals for yourself. And maybe as a parent, I think it helps you kind of to plan the goals of what you see the ability of your children or your students, what the abilities they have. I tend to look at things from an ability or strength perspective. So I like to see goals that are going to be tailored around the strengths of a student. You know, what are their abilities and where can we accentuate those abilities and how can we help them meet their fullest potential? And I think going back to that, first couple slides where I had the components, it's really about the education, getting to the employment, to the independent living. And that is why it's called an individual education program, because it's individual in its education and it is truly a program. So what is the purpose of an IEP? The purpose of IEP is to make sure everyone, you, your family, staff, students, peer supports, be aware of what your education program will be each year. I love peer support, so if you include other students in the IEP process, I think that's important. And I think it's more important as students get older that if they have friends, which are natural supports, that they can include in the IEP process. I think it's a valuable tool. Many of you all may have heard Erin Sheldon, who's from Canada, speak about her daughter Maggie in the IEP meetings they have in Canada. Well, one of the things that I find fascinating is they surrounded her with natural supports that are students that have kind of followed her through her educational plan. And now as she's gotten older, those students typically attend her IEP meetings because they'll help them frame out goals. And sometimes if you here's I always say, yeah, but you'll hear about sometimes school staffs, even including my own, as I work as a counselor, will say, yeah, but can we really do that? And then the students respond, it's not can we do it, it's how do we do it? And so the process becomes driven by the students, Maggie as the student, surrounded by our supports, so that everybody says it's not if we can, it's how can. Michelle, do you want to add anything to that component?
Well, I just think that is a very cool example of peer support. Through my master's program at Vanderbilt, I did a lot of research with peer supports for students with moderate and severe disabilities, and often, you know, you're exactly right that the peers are the ones saying, yeah, it's not if we do it, it's just how are we going to get her there and how can we help her. And I see that a lot, even at the elementary school level that I'm at with much younger kids, being so accepting, whereas I have to coax some of the other adults along with that. So yeah, very cool example.
Well, thank you for that, and I will say this, where you're studying has probably the authority on peer supports on faculty there. That's Dr. Eric Carter. And Dr. Carter is, he talks specifically about the importance. So parents, as you listen to this conversation, and we're talking about the annual meetings, and as your children get older, I would turn to research by Dr. Eric Carter, who is at Vanderbilt University, who does a tremendous amount of research on the importance of including peer support networks and peer support models into the process of developing IEPs, particularly at the middle and high school level. So Dr. Carter, I recently got to hear in Jefferson County, and I highly recommend his research.
And just a side note, oh, sorry, Eric. Dr. Eric Carter was my advisor, and I have a lot of his articles. So if anybody is looking for access to those articles, by all means let me know, or maybe in the questions after, and I would be happy to connect people with that research.
Fantastic. Good. Tell them that Eric Wright from Louisville, Kentucky said hello. So who comes to the IEP meeting? And really, it's lots of people will help write your IEP, your individual education program. Some are required by law to come to the meeting, which I have included in bold letters below. Others, such as parents, students, must be invited to take part in the meeting. And the people really are listed below. As a student gets older, particularly an Angelman student, I highly recommend that they be involved with the meeting, particularly starting at the middle school level and the transition to vocational services. So that's an important time. The Angelman parent or guardian, I believe it's important for at least one regular education teacher to be there, and then it's required by law. If you have two, that's better. I think at least one special education is required by law, but if you can have a second person, sometimes it might be the support, the person who's providing the support for the Angelman's child, and they're there. I think that's and when I say support, that's supplementary aids or services in the IEP. Could be the student requires someone to help them, and that requirement facilitates them being included in the meeting. Others may be nurses. We've had nurses attend IEP meetings other people who know about the individual strengths. Remember, I tend to like to see IEPs that are focused on students' abilities and strengths. So I like to see them in the meeting. And then also, it's important if you're receiving any of the following services: occupational therapy, which is OT, physical therapy, which is PT, or speech-language pathology, that your speech-language pathologist also be in attendance as well. Michelle, have you seen others that have attended when you've participated in IEP meetings?
The only other thing that the law literally allows for anybody that has an interest in the student's education to be invited to participate. So that's how, peers, I've had parents ask if a PE coach who knows their child really well can come participate and talk about the student strengths that, she sees in PE. The only other thing that's not listed here is what we call an LEA has to be there. So a representative from your local education agency has to be there as well, and that in general is somebody from the administration at the school that acts as the local education agency's representative.
Yeah, we call, and that's in the district I work in, the counselors often at the elementary school level are what we consider to be the ARC chairperson, and ARC is the Admission Release Committee. And so when we request an ARC of the Admission Release Committee to come together, typically in Jefferson County where I work, it's the counselor, but when it comes to placements where you're making a change in the restrictive environment, either to more restrictive or least restrictive, you typically kind of move up the administrative ladder, and you will have like a placement specialist that will be there acting in the authority of the district itself. All right, so how often is the IEP meeting held? Is the IEP meeting now? How long does an IEP meeting last? Wow. So this past week, I actually had an IEP meeting that went for almost 2 hours.
Eric, I can top that. I can top that.
All right, what's your
2 weeks ago, I was in an IEP meeting that was 4.5 hours. Granted, it was a reevaluation meeting as well, combined with the IEP meeting, but it was a long one. We didn't think it was going to be that long. Anyway.
And so be prepared. I think that the law says that IEP obviously has to occur once a year, and this means that you should at least attend one IEP meeting per year. However, students and their parents, you can ask for more IEP meetings. We call them ARC meetings. It's just you have to make it believe it's necessary to take a look at the individual education program or make changes. By law, in due process, you have the right to request that under IDEA, and you should be able to. You can even request to waive your notice, which is typically a requirement from the district, and you could say, I'd like to have that meeting as soon as possible. And as soon as they can assemble the ARC or the IEP members that are required to be there, you can have the IEP meeting. I think it's important to talk about, though, you have due process as a parent, and due process means that you're covered by law. To have, if you don't agree with something, you can request a due process hearing if you don't come to resolve in a meeting itself. So they have to have that ability to mediate that process as needed. Well, I think generally most IEP meetings last, I think, closer to an hour, but 30 minutes or more for sure. So that's typically, I think, how long they last. And why should you, the parent, participate in the IEP meeting? Because you're the essential component. You really, as anybody in the room, maybe besides the student themselves, you have the most power in the process, because it's really about trying to help frame out goals that are going to see your child be as successful as possible. And I think your opinions are extremely important. I think that when we provide our opinions, I think it's an integral part of the discussion. And I also believe that parents, you're there to advocate and be engaged in the conversation and to eliminate the yeah buts, but the how, and be a how can kind of agent for the whole process.
Yeah, I completely agree on that. And I do just want to point out that parents are a completely equal member of the IEP team. You are more than just a consent giver. You are, like Eric said, an advocate for your child, and you know what's best, and you do not have to sign consent for the IEP unless you completely agree with it. So be active and participate in that process. I really want to encourage parents that it's not just the school saying this is what's going to happen. It really should be an active conversation.
Yeah, and so the next slide here talks about what should you do if you want to help develop the IEP. And first off, I want to put a plug out there is go to the IEP Bank on the Angelman Syndrome Foundation website, which Michelle works diligently on to try to keep all up to date. And we encourage people to share goals. So if you want to help develop the IEP, I think there are 5 basic steps. Open communication with the teachers and the providers. So it can be by email, it could be by telephone, it could be face-to-face. I think you should always review the progress your student has made related to last year's IEP. And if you see the progress is made adequately, it's time to make new goals. Sometimes, if you see progress that takes place throughout the year, which you're required to get progress reports, you may need to call the IEP meeting to think about reshaping the goals to address the students where they're seeing progress to make sure that they're being challenged. Think about the strengths and the needs in the school. So that's really important too. When I say needs in the school, maybe it's accommodations for them to be successful in the classroom, or accommodations for them to be successful in open areas. Those type of things, they should definitely make sure they include those things into the IEP, and you're a big part of that. And then help write the goals for the school year. Don't, or at least help them frame out the goals. Practice what you want to say at the meeting before you go, so that when you get there, you've got your, I would say, your ducks in a row, and everybody on board knows that you've done your homework and you're ready and you're prepared to administer the or to be part of the process. So now we're going to get into some of the specific sections of the IEP. And so by law, your IEP must include certain information. And this information is usually organized into sections listed below, which we're going to get to. Your new IEP will also have these sections or information, and here's what they are. So here are the components of the IEP. The first component is present levels of the IEP, and it's the present levels of academic achievement and functional performance. We used to call those PLEP, PLEPs, but now it's just PLPs.
Well,
and sometimes, go ahead.
Eric, my district actually this year switched from calling it PLOP, P-L-O-P-S, present levels of, I don't even know what the O stood for, because I wasn't working for the district last year. But then this year they're calling them PLEPs, P-L-E-P-S, so present levels of educational performance. However, through my training at Vanderbilt, I learned to call them the present levels of academic achievement and functional performance. So I think the key word is going to vary by district. The key words, though, are present levels, and that just really refers to a description of where the student is at in this area right now.
That's exactly right. And typically, the present levels should be maybe even broken into various distinctive parts. It could be academic achievement, and then functional performance, which could be social emotional performance, and also if you have speech language, it could be communication performance as well. So when we have IEP meetings, typically I start with the communication levels. If there's speech language pathology involved, I let them discuss the present levels in communication. Then we go to the academic components. Then we'll let the occupational therapist and physical therapist discuss their present levels. And from there, we start framing out the goals. So there are some special factors, too, that you could be in there, which are called behavior intervention plans, a BIP. I don't typically see a lot of this with children with Angelman syndrome from my experience, but there are students who do need behavior intervention plans as part of the special factors. Another thing to know about, too, that's really important is extended school year. Extended school year means that if there's any type of data that would show there could be potential regression of a student's present level performance, academic, functional performance, communication performance, any of those three areas or other areas that might be impacted on their present levels, that your student can qualify for extended school year services as part of the IEP process. So that's under special factors. The third component is your goals and objectives, which we're going to give you some examples of those in a few minutes. Your services and supports, that means like, I think of it like accommodations. So maybe a statewide testing accommodation, or most children with Angelman syndrome are on what's called an alternate assessment. And it will be very specific that we have, as the ARC committee or the IEP committee has convened, that the ARC committee and IEP committee has deemed it necessary to have the student on the alternate assessment. Do you all use alternate assessment, Michelle?
Yes. We have, it's going to change next year for Tennessee, and this is going to vary. Every state's alternate assessment is going to vary, but we have what's called a portfolio assessment, and instead of sitting down one day at the end of the school year and taking a test, my students with the more significant disabilities, we select some goals for them. We are taking data on them throughout the year so that they have more than one opportunity to show their progress on these goals. That is their alternate assessment, and that's what gets submitted to the state.
So it will vary state to state. The fifth thing is the placement consideration, and that is whether it's going to be a part-time special ed or full-time general ed with resource, or they'll break it into what is going to be the accepted least restrictive environment. And me personally, I'm an inclusionist, and I like to see, but I understand that there are certain things that are presented to students in a more specially designed instructional setting by a teacher who has that training. I tend to lean more on trying to include the students in the least restrictive environment general ed with supports. And once those placement considerations are in, those can vary year to year too, according to what the ARC or the IEP committee deems necessary. And then parent contact information, summary components are that, and then a list of the participants with signatures of all those, are the participants in the IEP as well. Let me see here. Anything you want to add to that?
No, I'm getting ready for our next slide, the meat of the IEP.
All right, so the three main areas that connect an IEP are as follows. Their present levels, which this slide shows, their academic needs, their functional needs. It should all be based on data. There should have been a baseline for the data to be derived from, and the fact that the present levels drive the goals. From the present levels, you develop annual goals. And you have to have a goal for every need. It should be measurable and realistic, and the student should make progress. Once the goals are written, you incorporate service and supports, such as what progress we're going to have what are we going to need to make progress towards the goal? What are we going to need to make progress in the general education curriculum? And what are we going to need to have this student educated with non-disabled students, which is the least restrictive environment. So those are the three main areas that connect an IEP. So we talked about this before we got on the webinar tonight about the difference between standards-based IEPs and what's called instructionally based IEPs. I'm going to review a little bit about the standards-based component, and then I think, Michelle, you talked that you want to add some information about instructional-based IEP.
Yes.
Standards-based in Kentucky, we are using the Common Core standards. So most of the IEPs are going to be based on those standards. And not that we're restating what the standard is in the goal or anything of that nature, but really it's in relation to where the student is related to the standard, and the goal is going to maybe address the needs and the specific needs related to the standard. A lot of times we talk about separate class or a resource class where you teach the standards unless it is a support class and not in place of the regular class. Typically, I don't really advocate a lot for this. I like resource at times for more organizational strategies. If we're going to talk about the student who's getting resource, I am more of a collaborative component. Like I like to see collaboration between the special ed teacher and the regular ed teacher, where they're actually collaborating to specially design the instruction with the right accommodations and methodology and delivery method that's going to be suitable for the student and that will be beneficial for the class as a whole. So I'm going to be a component of the co-teaching, which is the next point, the collaboration and supportive instruction. And I think that is important where you have both teachers, the regular ed teacher knowing the student's goals and accommodations and using them, and then implementing those accommodations with the right supplementary aids and services. Now, if you want to add in a little bit, that'd be perfect. Go ahead, Michelle.
Okay, so the district that I work for has moved away from standard-based IEPs and is writing what we're calling instructionally appropriate IEPs. So that they're all, the goal is still the same, to address the specific needs individualized to that student. The difference with instructionally appropriate IEPs is that we don't have to tie it to the specific standard. We're tying it to the need that we see with the student, the need that we have written about that is a deficit in the present levels area, and writing a goal specifically tailored to that and not specifically tailored to a certain standard for that student. Eric, does that make sense?
It makes a lot of sense, and
okay.
It's in a lot of ways it makes more sense than standards-based at times.
Well, yeah.
And by the time we're done presenting this webinar, everything will change tomorrow. I'm being facetious, but things so often change in special education. But I think we're giving you the main tenets of IDEA and IEPs, but things do change frequently as well. Fair enough, right? Is that what we would agree upon?
Yes, completely agree.
So I want you wanted to take over and talk a little bit more about this. Is that correct?
Sure. Yeah. So we've hit on kind of the main sections in overview form. We're going to kind of go a little bit more in depth to these main components. So number one on the slide, present levels of educational performance. Again, generic term would just be present levels. This section needs to include precise information about how the student individually is doing in school, and can also include not just academic areas, but other domains as well. For example, my district requires us to determine if the student is exceptional or not exceptional in, it's up to now like 12 areas. So we have basic reading skills, math problem solving, math calculation. The most important ones, I think, for, not that academics are not important, but on the flip side of that, ones that you really want to hit on specific to Angelman syndrome are the communication present levels, their social emotional, the social emotional domain, the adaptive behavior domain as well. At least we are required to determine whether the student is exceptional in those areas as well. So again, I just want to stress, it doesn't, depending on the district, it's not necessarily tied directly to strict math, literacy, reading, etc. performance. So from there, oh, and I did want to say that the present levels are based on, they need to be based on formal and informal data. So what you'll often see in them, and you'll see in the examples that I have in a couple of slides, at least I tried to add formal data in there, fake formal data, of course. formal data would come from tests, would come from any sort of more formalized testing, assessment. If there's a formalized, I know there's adaptive behavior checklists. We have pre-vocational checklists as well that several different adults that work with a student can complete. That would be your more formal data and is completely appropriate to have at the present level. You also then want to have informal data that is more narrative based on your observations of the student, and this is all not just the special education teachers. You want to include all, essentially all the adults that are working with the student. And observations, things that they're doing really well, their strengths, and then you want to make sure to put in there, I know we want the IEP to be really positive, but we have to have an area of where we can develop a goal for this next year. So in the present levels, we have to put some sort of where their deficit is, what can they work on, what are their weaknesses right now, what can we build a goal off of. So that moves us down to number 2, where from those present levels, you're figuring out a goal for the year, which can then also be broken down into short-term objectives or benchmarks. For example, if the annual goal is, say, learning 100 sight words from whatever list you're choosing, then a short-term objective could be, for this 9 weeks, for this quarter, we're going to work on 25 words, and then the next quarter, we're going to master 50 of those words, and then move up so that you're all the way up to 100. That's a really brief overview of goals versus objectives, and that is something that also really varies by district. If you have questions, let me move through these examples, and then hopefully we'll have some time for questions if there are any related to that afterwards. Another very important thing in the IEP, and this is directly related to service time, you have to have an explanation of how much of your school day, if any, the student will spend not participating with children without disabilities in the regular class and other school activities. And so there'll often be a statement in the IEP about how the disability adversely impacts the student's participation in the general education curriculum. That's how my district has us write that statement, and so it needs to say in there, so there's no room for interpretation, how much the student will be participating in the gen ed class with those peers. So Eric, if you want to move us to the next slide.
Yes.
We're going to begin with modifications and accommodations are another thing that is in a huge component of the IEP. This, I know we've kind of briefly talked about the state and district tests that this also applies for. I also want to mention that this applies for just during general subject areas as well. You can have specific accommodations for science versus for math, or if, like, say your student happens to be completely on grade level with math and doesn't need any accommodations. That probably isn't that specific to Angelman syndrome, but just an example, you wouldn't have any accommodations for math, but then for reading and social studies and science, where there may be more reading, you could have a whole bunch of accommodations for reading, or sort of behavioral accommodations in there. And then the number 5 here is when and where the school will start providing services, how often the services will be provided. So that's usually how many times per day, how many times per week, and how long those services are expected to last. So an example of that would be, if they're going to get speech 2 times a week for 20 minutes each session, and then that starts when the IEP date starts and then ends, when the IEP ends. And then Eric, can you move us to the next one? So, okay, so number 6 and number 5 are very similar in that special education and related services includes OT, PT, speech, if there's any behavioral support. I'm not sure what else other districts have, but those related services are also included in there. And then once the student gets to the age of 14, transition services and transition components are required to be on the IEP. So transition is a whole nother area. Eric, did you added on here portfolios and About Me surveys. Did you want to talk at all about that, or table that for now?
Well, with the portfolios, what we typically will do is we've gotten to a component now where it's really coming into person-centered planning. So it's like where you're really trying to focus on what is the most likely scenario from a person-centered perspective of their vocational or educational, their employment type setting in the future. And I am a huge advocate of person-centered planning. It does typically make the IEP process a lot longer as far as the planning and developing, but in the long run, it sure helps. It helps to frame out their employment goals in the future, I think.
Yes, completely agree. Okay, so I have 4 examples here, and after these 4 examples, we'll open it up to questions if we have any. We're kind of running out of time, so I'm going to go through them a little bit quickly. These present levels are not as long as I personally would like to see on an IEP because of the space that we're working with here in this presentation. So just a caveat before I start going. So for example, for the domain of math, a present level could be in the test of early mathematics ability administered in September 2014. Math scored a standard score of 60 in the area of math. So that's your formal data. And then now moving into the more informal data, Matt was only able to receptively identify 3 numbers. So for example, that means point, if the direction is point to the number 3 and he's pointing, that's his receptive identification of that. And with those 3 numbers, he's relatively inconsistent. He can count up to 2 objects consistently, but past 2, he does not demonstrate one-to-one correspondence when counting. So there's a very brief present level. Directly related to that, the annual goal could be, given a number 1 through 10 in manipulatives, Matt will count out a set of the given number with 80% accuracy on 4 out of 5 data collection days as measured quarterly by Teacher Data Collection by October 1st, 2015. I know that for those not familiar with an IEP, looking at an IEP and looking at the annual goals is so overwhelming because we have to put all of that wording in there. And I could do a whole nother webinar on how to write annual goals. However, you want to make sure, just in brief, that there's a way to measure that and see the behavioral change. So for this annual goal, Matt will count out a set of the given number. That's directly related to your math goal above, and that is something that I, as a teacher, am specifically working on with that student. So from there, we know that that's his math goal. We're going to accomplish that via the services where he's getting academics instruction in the special ed setting with a special education teacher for 30 minutes each day. So Eric, can you, yep, next one. Okay, so this one, let me kind of try to skim through this communication example. So for present level, according to the functional communication profile completed by parents and special education teacher, Jane is a total communicator. I know that sounds repetitive, but that's how they phrase it on this. This is a formalized functional communication profile. Using eye gaze, gesturing, physical manipulation, vocalization, facial expressions in order to communicate. Jane sometimes, so those are the categories so you're pulling some of your narrative from that more formalized assessment that adults, kind of this profile that adults are able to fill out. Let's see, Jane sometimes communicates for the following reasons: to gain attention, make requests, express rejection, express wants and needs within an activity, to express activity choice, to respond to questions with yes or no. I'm going to move along. The next line says she does not typically independently communicate for the following reasons. And again, these are all things that you check as part of this functional communication profile. And then it goes on to say, although she is able to communicate for a variety of reasons stated in the first part of the section, so now we're moving into the more narrative and observational part of the present level. Her functions are not consistent and often require prompting. Jane is able to make a variety of spontaneous vocalizations and does not use words to communicate. She uses basic gestures to point and show her wants and needs, and also fluently uses eye gaze during interactions. She responds to her name but inconsistently follows directions to select an item from two objects. She will look at a picture of an object or person with intent but does not yet exchange pictures for communicative purposes. So, after going over that present level, you could see that you set it up perfectly to have the annual goal be given a picture symbol to represent her wants and needs throughout the day. She'll give the picture to an adult to communicate her wants and needs with no more than one verbal prompt, blah, blah, blah. So directly from that present level, we're getting where she is, where her weaknesses are. This, now, side note, this isn't the only goal that you could develop from this present level. I only put one goal on these examples, just so we could focus on, kind of one thing at a time. But you can have multiple communication goals related to this communication present level. And so then again, tying that to the services, to work on this goal, she's going to get speech therapy and consult in a special ed setting with the SLP specifically for 30 minutes 2 times a week, for example. And then I have 2 more examples here. Eric, if you would mind moving us forward. Adaptive behavior. So I still get confused on the difference between adaptive behavior and social emotional behavior sometimes, and pre-vocational and vocational behaviors. So it always helps me to go back to the more formalized assessment. So for example, in this first line of this present level, the systematic adaptive behavior characteristics checklist showed that Matt appears to have little understanding of personal hygiene unless prompted and has a limited understanding of appropriate social interaction in regards to community use, and these are all domains of adaptive behavior that are in this characteristics checklist. In regards to community use, Matt needs full supervision to move about the school and sometimes exhibits inappropriate behaviors relating to school rules, which appear to be due to a lack of understanding. Matt will currently work independently for about 2 to 3 minutes, and then will seek out interaction from either adults or peers. He rarely exhibits self-correction and has significant difficulty organizing activities. Matt also does not understand safety issues, and without supervision would put himself in danger. For example, he'll walk into a multi-crowded street without adult prompting or having supervision. So all of those kind of descriptions are directly from the systematic adaptive behavior characteristics checklist. So from that description, we get our annual goal description. Given a task targeting an already acquired skill, Matt will work independently for 8 minutes with no more than 2 prompts on 4 to 5 consecutive data collection days, blah, blah, blah. So because we talked about in the present level that he's really only working independently for about 2 to 3 minutes and then is seeking out interaction, the goal we're going to work on is working independently for longer periods of time. And to work on that, the services is going to be academics instruction in a special ed setting with a special education teacher for 30 minutes each day. And then the last example I have here is in the pre-vocational domain. And so again, I started it off with a more formal data. The pre-vocational checklist showed that Gina often does not follow directions given during large group instruction without additional prompting. She also has trouble seeing non-preferred tasks through to completion. Her off-task behaviors and desire for social interaction make it difficult for her to participate independently in structured, which are usually instructional, settings. She has had difficulty keeping her hands to herself and has shown improvement in the last month. So then again, oops, sorry, there's a typo in there. That present level is supposed to say pre-vocational. To tie that directly to the annual goal, during time spent in proximity to peers, Gina will keep her hands to herself and maintain appropriate personal space with no more than 2 prompts on 4 consecutive days, blah, blah, blah. And then again, to work on that, and again, and these are all just examples of the services you could provide to work on this specific goal. Academics instruction in a special ed setting with a special education teacher for 30 minutes each day. Because this one especially this goal is related to peers and personal space, it might be even better to have this service time be in the general education setting with a paraprofessional who can help her work on that, or if you want the special education teacher to work on that as well, in that gen ed setting because it's around peers. Or you're going to do your pull-out instructions, talk about personal space, work on that with her, and then put her back in the gen ed setting to practice that. So services can be, when deciding you have to decide what the best teaching method is when deciding what the services are going to be in the IEP. So I know that was a lot in the span of about 10 minutes. Eric, do you think I missed anything important?
No, I think you did a super job. And what I think is important to understand is there were a couple things that kind of jumped out at me. And I think the differentiation between adaptive behaviors, I think that's critically important for children with Angelman syndrome.
Yes.
And the functional behavior, too. Those are so important. And so sometimes I think we should really tend to spend a little bit more time focusing on goals related to that. And I think, too, literacy is a hot topic anytime with Angelman syndrome right now. And literacy components, I think, sometimes can just be exposure to literacy in a more structured setting. I tend to not like to see letter identifications, sight word identifications. I like to see what's called the nondescript pencil, where it's a free-flowing ability to put words into an organized fashion, and then also just have them fully exposed to rich reading, and I think that's important. So with that being said, I think we will have just a few minutes to address any questions. So we'll turn it over to our moderator, and we'll ask her to help start the process of answering questions.
Okay, we have just a couple questions that we'll go through. Before I do that, though, I did want to mention, I forgot to mention at the beginning of the webinar, that Dr. Wright and Michelle are both members of our family resource team at the ASF. And, you know, if there's anything that you think of after the webinar today, or really any other time, you can contact them. Just go to the resource section on our website and go to Family Resource Team, and there's a form you can just fill out with your contact information, your question, and we'll get it to them, and you can, you know, chat with them either over the phone or through email, and they can help you not only with IEP related things, but pretty much anything. So, and now to the questions. First question is, if you don't agree with the IEP, you stated that you don't have to sign it. I'm usually told that my signature is needed to show that I was there. That usually keeps their choices in place. Can I refuse to sign even if I attended?
So, Eric, chime in because I feel like you know the legal side of things a little bit better than I do, maybe. Go ahead.
You don't have to sign if you don't agree. Hopefully you don't get to this point. That's a critical component of our presentation, is hopefully there's open dialogue and communication, that you are teaming together to develop the IEP. Now, they may ask you to sign a conference summary. I say you should do that, because in the conference summary you can state that you want, under summary notes, which is required, a due process. It's a due process piece of paper. It's a conference summary that you state you do not agree with the IEP and you've requested to move to the next level of due process. And then that, feel free to sign, because then what you're essentially saying is you don't agree. When you come to a typical meeting for an IEP, the IEP typically in my district, we don't sign IEPs. We sign conference summaries. And conference summaries represent the due process document, and the IEP is the legal document. Once everybody is agreed, then we say we all have agreed on the new goals in the IEP. But if you don't, then it's really required of the person who's drafting the conference summary to state, the parent did not agree with the goals, and we'll be pursuing due process.
So, just to give a different example of that, at the IEP meetings in my district, the parents have to sign two things. There's one thing that there's one paper that is just IEP participation, where the members that were at the IEP meeting sign it saying they were there and they participated in the meeting. The second piece of paper that the parent specifically signs is the IEP consent form, where they are giving, that's the parent signing that they're the legal guardian, they're giving consent, and that they're in agreement with this IEP, and it's okay to, you're giving your consent to move forward and accept the IEP. There's also, side note, as I'm thinking about this, the page, again, specific to my district, the page that has your, where you're signing that you participated in the meeting, there's a yes or no checkbox asking if you are in agreement. And so that is a place where you can say you're not in agreement, but that you were there and you participated. If you do not sign that consent page, you have 10 days from the meeting date to sign that page if you are in agreement. Then if you're not in agreement and can't get to an agreement, with a follow-up meeting or anything, that's where you start the due process as Eric is describing.
And also, we do consent for services as well, and consent to evaluate it on a 3-year re-eval. So we do that as well. So it is similar to that aspect as far as Michelle was describing. All right, any other questions?
Yeah, we have two more that I'll try to get through. The next one, actually, Dr. Wright, is for you. The attendee says that they're curious to know if your daughter with AS is deletion positive, and if so, how is inclusion going for her? Our son, who is deletion positive, is almost 3, but still has the cognition of a 6 to 9-month-old. He's currently in self-contained preschool, but they're interested in learning about any potential benefits that you've seen to inclusion.
All right, so I'll answer the question very distinctly. I have seen, first off, similar circumstance. We started early interventions up until age 3, and then drafted the IEP at 3 for preschool setting. But we actually denied services at 3 until we started kindergarten, and we did our own preschool setting in a preschool that was an inclusionary preschool that was private. At age 5, we consented again for special ed services, but we were very firm after my role in advocating for full inclusion. And through due process, I'm going to be quite honest, through due process, we were able to come to an agreement within the district. Of course, I'm an employee of this district as well, but we had to come to an agreement that we were going to seek full inclusion with supports. And I have to say that it's gone remarkably well. And I definitely can see how Elsie her functional and adaptive behavior has been significantly improved from her being around her typical peers.
And just to add to that, my brother is, I know the question was geared towards Eric, but I completely agree with Eric, because my brother is deletion positive, is exactly the same way, where he's 19 and he probably sometimes is still, in the 6 to 9-month-old range, if you were going to look at a formalized test in that way. He was fully included all the way through elementary school, and my parents fought for that. And to him, that being around the peers was so important to my parents, and I'm so glad that they fought for that and had him fully included with support during the day, because we're not, the focus of his education was not learning his letters, learning letter sounds, learning how to count 1, 2, 3. It was how to be around peers, work on that adaptive behavior, different, methods of communication, things like that. So I also am in support of inclusion, obviously, as well. And since it sounded like this question after their child was 3, there's still plenty of time to help develop that. And so maybe Eric and I could give tips or something through the family resource team as you guys are getting into kindergarten and through elementary school.
And my daughter is deletion positive.
Okay. Last question. It sounds like this person is looking for advice. Their school PT is using medical as a reason to deny service for IEP goal relating to PE, such as hopping, running, and balancing.
Interesting. Using medical.
I think I can answer this one because I dealt with this one, okay?
Okay.
So I have my oldest daughter who had a swallowing issue, and it was documented under medical. And the speech-language pathologist attempted to address it by trying to insisting from a medical standpoint that her food be completely pureed to be able to be eaten every day at lunch. I took it upon myself to contact Protection and Advocacy in the state of Kentucky because I did not agree with that. We moved directly to due process where I waived my 7-day notice, and I brought what looked like to be a pureed plate to the table, and I said, how is it that she's going to differentiate to what food she wants to eat when she can't even determine what foods they are? And I said, I think any child could have had a potential aspiration experience on corn, on hot dogs. It just happened to be my daughter had that experience on a piece of corn. Since then, she has not had one issue related to swallowing. So you have to be very, very firm and say, if we don't want to move to where we could have physical education, then you better sure as heck have some adaptive leisure activities taking place in an inclusive setting.
Okay. And again, I mean, if the person that asked that question, needs some more help, please feel free to reach out to Dr. Wright or Michelle about that issue also. So that's about it. We really, we ran over on time, so I thank you so much, Dr. Wright and Michelle Harvey, for joining us today and sharing so much of your professional experience and your personal experiences to help so much. And thank you everyone for joining us tonight. And again, you can look for links to recordings of the webinar to either rewatch or share with friends. And thank you again for attending with us tonight.
Thank you.
Thanks, everybody.
Bye, Michelle.